This is the head of pancreas. This is the neck of pancreas. Uh, this is the body of pancreas. This is the tail of pancreas. And we see the properly pancreas view the time shows this image, and it is this organ visualize is difficult, but you see you apply the technique and it is easily show the skin. Otherwise it is difficult, and you see the pancreas, that time your position is transverse, probe position is transverse and backwards, that time you see the properly pancreas image. Okay, and this is we select the see the pancreas head, neck, body and tail. Bismillahir Rahmanir Rahim. Assalamu alaikum rahmatullah. Welcome to Ultrasound TV. And dear doctor, how are you? I think all are well. And today is our topic is ultrasound of pancreas or upper abdomen. Upper abdomen organ is pancreas. So pancreas, how to detect pancreas by ultrasound, and it is easily see the properly by the ultrasonography, and how select the probe and technically apply the properly visualize of pancreas. So pancreas is difficult visualize by the ultrasound. We make a some application by the easier to see the pancreas. So it is very important things because when time we see the pancreas, and patient is need preparation and probe selection, and patient position is important. And when time you see the ultrasonography of upper abdomen, that time need patient preparation 1 or 2 hours ago, and patient taken 1 or 2 glasses water, and there is the important things of properly see the pancreas, and patient is ready for ultrasonography, that time we see the properly pancreas. So we going to see the pancreas technical application apply to patient today. Okay, thank you very much. We see the pancreas. When time we see the pancreas, that time probe direction is transversely and mid clavicular line, and epigastrium region transversely. Probe direction is transversely, and probe see to see the 90 degree or to see the oblique or backwards. And when time you probe direction is oblique and backwards, that time you see the left lobe of liver and pancreas. This is the important for visualize of pancreas. Okay, this is the splenic vein, this is pancreas, this is left lobe of liver, and this is abdomen aorta, and further we see the pancreas. This is the real time mode. Real time mode, when time we see the real time mode, that time, and movement is abdomen aorta pulsation. Here is abdomen aorta pulsation. This is splenic vein and portal vein. This is the pancreas. And pancreas is easily detected by ultrasound. This is pancreas. This is abdomen aorta, this is splenic vein, portal vein, and this is pancreas, and this is left lobe of liver. And this is the pancreas view, and some organ present here. That time you select the pancreas, otherwise you don't select the pancreas. Pancreas is echogenicity is hyperechoic, and liver and pancreas, we compare the liver as pancreas compare. That time you see the pancreas is hyper. This is pancreas view, and this is real time mode. Real time mode, we see the pancreas, and upper side the left lobe of liver, and splenic vein, portal vein, and abdomen aorta pulsation. This is the pancreas. We can measure now. This is pancreas measure, and this is a head. This is neck. This is body, and this is tail. Okay, this is continuation of pancreas. Look like a pancreas shape is triangular, and this is tail of pancreas. This is the body of pancreas. This is the neck of pancreas. This is the head of pancreas, and this is the left lobe of liver, and this is portal vein, and this is splenic vein, and this is abdomen aorta. We are see the ultrasonography of pancreas, and how to technique, and how to see the properly pancreas visualization. And when time you visualize the properly ultrasonography, easier, and technical apply. Technical apply is probe direction is 90 degree and transverse, and probe obliquely and backwards. And when time you obliquely backwards, that time you see the properly pancreas, otherwise not see the pancreas. And thin patient is easy for visualization of pancreas. Or technique, I think technique is very important, because and your probe direction is not right way, and this is not see the pancreas, and you should must probe direction is important. Probe direction is 90 degree, or mid clavicular line, or upper abdominal side, like epigastrium region, and transversely. Probe direction is transversely and upper abdomen, and 90 degree clock direction is to see the properly visualize of pancreas. So it is very important. And dear doctor, when time you see the pancreas, and your probe direction is 90 degree and backwardsly, and then you see the properly pancreas. So pancreas image is like first time we see the head, and neck, and body, and tail, and four part we see the pancreas, and visualize the four part of pancreas. It is the important. And thank you very much, and welcome to Ultrasound TV.